Well, top health experts are warning of a spike in coronavirus cases following the Thanksgiving holiday. Despite guidance from the CDC, millions of Americans chose to travel amid a nationwide surge in cases. With the holidays just around the corner, widespread travel could likely happen again soon.
That's right, but amid the spike, there is some promising vaccine news. Moderna and Pfizer are both seeking emergency approval, with initial rollouts possible within the next few weeks. But health officials are reminding Americans now is not the time to become complacent. Joining us now is Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, great to have you with us on the show. A lot to get to, so let's get right to it. We know coronavirus cases, hospitalizations, and deaths are all rising in the U.S. You have urged officials to close bars in New York, for example, but reopen schools, citing data that spread among children is relatively small. Where are leaders getting their reopening priorities wrong in states where cases are climbing, and do we need to shut down again?
Well, I don't think we should be shutting down in the sense of the true lockdown, but what we need to do is to uniformly and consistently implement the fundamental public health measures that we know, when they are implemented by states and cities, do have a substantial impact on blunting the inflection of the curve. That's uniform wearing of masks, physical distancing, avoiding crowds in congregate settings, particularly indoors. And when you can't avoid it, make sure you wear your mask indoors. Doing things to the extent possible, given the weather, doing them outdoors, preferentially over indoors, and washing your hands frequently. In the enormity of the situation we're in, that seems rather simple. But in fact, it does work. We know when you look at states by states and compare them, those states that have mitigated with these public health measures have clearly had a deflection of the curve that is very steep now as we get into this colder weather. So those are the things we need to do. You don't need to necessarily lock down in the classic sense. You can do a lot short of locking down.
Dr. Fauci, to that point, how do you convince officials or anyone to make decisions based on sustained health outcome and not be motivated by perhaps immediate economic benefit?
I mean, I think you've just answered your own question. You've got to get them to understand that in the long term, getting this virus, this pandemic under control will hasten economic recovery. And you can be doing steps towards economic recovery while you implement these moderate types of public health measures. There's a misperception that it's all or none, that either you don't implement any public health measures or you lock down. That's not the case. And that's what the misunderstanding is, that some people, leadership even in cities and towns and states, feel in order to keep the economy going, that you put aside all the public health measures. That doesn't work. That's not prudent. And you could still get good, slightly increasing, going in the right direction with the economy without necessarily having everything fall apart. And I think we need to continue to get that message. It is not an all or none phenomenon. You can do both. You can do prudent public health measures and still continue to open up gradually the economy.
Dr. Fauci, I just want to echo Nora's sentiments. It's great to have you in conversation here on Cheddar. You have served under 6 U.S. presidents, a leading figure in the Trump administration in the coronavirus response. Now, even amid the transition period between administrations, is there more that the Trump administration could be doing right now?
Well, we could be doing what we're actually doing. I think what we've seen now is the health officials, myself and my colleagues on the coronavirus task force, have been out there with a very consistent message of what needs to be done. It really is in the hands of the local people to appreciate that this consistent message needs to be followed. One of the reasons among many why there has been difficulty, some beyond our control, many other countries who are trying as best as they can are in the same difficult situation that we are in now, as those of us in the Northern Hemisphere get into cooler and cooler weather, which necessitates doing things indoors. But what we have in our own country, a little bit different than some of our colleagues in the European Union and in Australia and Canada, is that we're a federalist society. This dates back to the founding fathers. The states have a considerable degree of independence in what they do. And often we see an inconsistent approach where some states are doing it correctly and other states are not. And some states are trying to do it correctly, but there's a lot of pushback from the people who live in the states because of everything from COVID fatigue to just not believing that this is real. It's astounding how many people in certain parts of the country still thinks this is a hoax or this is fake news. When you have 250,000 people in this country, more than 250,000 who've already died, and more than 13 million have been infected. And yet there's still people who believe this is not an important issue. That's striking.
And that speaks directly to the environment that we found ourselves in with this coronavirus pandemic, and that something we've had different from our European counterparts and other countries around the world is we did this in the middle of an election year. And so there has been this politicizing of the virus, just as you were mentioning, the states and their different approaches, and the president talking about red states, blue states, and that framing. How can we depoliticize the virus? And are you optimistic about that under a Biden response?
Well, I hope things change in that we have a situation that's less divisive. I'm not sure that's going to be an easy thing to accomplish. You know, you mentioned correctly about the circumstances in which we find ourselves in with a historic pandemic, the likes of which we've not seen in 102 years since the 1918 pandemic. And the issue is, not only is it the tension and the stress and the politicization of an election year, but it's the fundamental divisiveness that we see in society, unlike anything that I've ever experienced. I mean, I've been, as you mentioned correctly, I have served 6 administrations, soon to serve my 7th administration. And in all of the times where we've had crises, be it Ebola, be it anthrax, be it pandemic flu, be it any of the other things that we've had to face, even though there were political differences, there was never this degree of divisiveness in our country where public health measures have been politicized. That's very unfortunate. And things don't work well when you put into the political arena fundamental public health measures that should have nothing to do with politics or ideology.
Dr. Fauci, I want to repeat something you said, that people are getting tired of COVID fatigue. A lot of people still think it's a hoax, fake news, to that point of it still being politicized. But also contributing to that fatigue is the fact that, guidance, of course, has changed over the course of this pandemic. It's different from state to state. But I do want to get your perspective on which states are actually doing it right and doing it well at this point in time.
You know, I don't want to tell you that because that just leads to trouble. Because when I say what you're doing well, then those who are not mentioned think they're doing poorly. I think it's important for your listeners and viewers to understand that there is a great degree of variability. It has not been uniform, and it's the lack of the uniformity that's been the problem, rather than to point out people who you might be considering winners or losers.
Very good points there, Dr. Fauci. And as we do consider the efficacy of these mitigation measures that are being taken across states, what is the best way to understand if they're working, especially if you compare things like masks versus face shields, or partial reopenings of schools versus full reopenings of schools? How do we know exactly what is working?
Well, what you see is a decrease in test positivity, a decrease in actual cases, decrease in hospitalizations, and decreases in deaths. There's always a lag between the cases that occur, the recognition of the cases, the hospitalizations, and ultimately the deaths. If you want something that you can follow in real time, it's what we call test positivity, namely the percentage of the tests that you do that are positive, the number of people that are getting infected. When you follow, and we've had the opportunity of looking at it like state by state, where you compare one state to another that have characteristics and demography that are relatively similar. So they're comparable states. And you see a surge in cases. One state does one thing and the other state does not. And that one thing are things like uniform wearing of masks, closing of the bars, avoiding congregate settings, whereas the other state might say, well, we're worrying about the economy, we're not going to do those things. There's no doubt that the states that implement the public health measures of mitigation, you see an identifiable diminution and bending of the curve of the inflection of the outbreak. We've seen that time and again. We've seen that when you compare one country to another, and we've seen that when you compare one state to another. So we know what works. We don't have to keep proving what works and what doesn't work. We just need to do it.
We know that this is all happening at a time, this spike, this surge, at a time where millions are going to be traveling for the holiday season like they did for Thanksgiving. It often takes weeks for us to really know the impact from a traveling event such as that. But if we continue to see a surge like this, at what point does the healthcare system as we know it become kind of or kind of exceeding its limits, I should say?
Yeah, that's a great question. And in some sections of the country, we're perilously close to that threshold of really running out of beds and, even more importantly, running out of trained personnel. I mean, there are reports from places like, there was a very well-recognized report from Billings, Montana, where they had a hospital, which is the most sophisticated hospital. They have 25 intensive care beds, and they have 40 plus intensive care patients. That is a precarious situation to be in, because then you start putting patients in beds that are not in an intensive care setting, and then you have people who are not necessarily trained to be able to take care of intensive care because there are so many patients. We don't want to be there in a broad way. That will happen if we don't address the surges that will occur, as you're suggesting. They do occur 2 to 3 weeks after something like a big travel event for the Thanksgiving season. So yesterday was the end of the Thanksgiving travel time. If we're going to see, and I fear that we will see, a surge upon a surge based on all the travel and the congregate settings, innocent, wonderful congregate settings that you have with family and friends, that we likely will see a spike superimposed upon the already existing spike, which would mean that we've really got to be careful as we approach the Christmas season. And people need to ask themselves, is it really prudent to do the kind of traveling in this season that you normally would have done? Even though obviously it's very difficult to accept a Christmas season without all the gathering and without all the travel that we usually do, it may be a time to say, we've got to assess and determine the risk-benefit determinations of this type of travel and of this type of congregation, and maybe say the better part of judgment would be to just say, this Thanksgiving, this Christmas is just going to be a bit different than previous years. We're not going to be able to do the kind of travel and the kind of things that we've done in the past. Better say, we had great Christmas and Thanksgiving last year, and we hope to have a great Christmas and Thanksgiving next year. But now is not the time. Now the time is to stay safe and protect your loved ones.
And these travelers who do end up traveling are turning to testing, to diagnostic testing, to try to mitigate spread. But of course, there is a lot of confusion around testing itself. So from your perspective, how reliable are rapid diagnostic tests or at-home tests? And ultimately, what advice do you have for those who want to gauge their health before and after travel around the holidays, especially for those who cannot quarantine if they do end up traveling?
Yeah, obviously you can get a considerable amount of information from testing, but one of the problems with testing is that I could test today negative and then be exposed tomorrow, go to my mother's or father's house if they were alive. They're not, but if I'm the prototypical person, and get all of a sudden infect them. So unless you have the capability of testing and getting the result every single day, you're not going to be able to protect yourself by just testing. And I think that's the misperception, that the way testing is right now, the availability of easily available point of care test, sensitive, specific. You get an answer right away. It's cheap. It's easy to get. We're not there in a broad way. Some of those we have available, but not broadly for the country. And that's the reason why people have a misperception. I could, right now test negative, get on a plane to see my daughter where she lives, or to see a family member. And when I'm at a crowded airport or on an airplane or on a bus getting to where I need to go, wind up getting infected. So what does that negative test mean that I had yesterday? That's what we mean where we can't rely on testing to be perfectly safe.
Doctor, while we have you, almost every Monday in November, we've received vaccine news, Pfizer, Moderna, AstraZeneca, Oxford. Distribution of the vaccine, it presents a logistical challenge given the storage requirements at sub-zero temperatures prior to administration. So how far along is a sustainable plan to provide access to any of these vaccines?
First of all, we should let your viewers know that this issue with highly efficacious vaccine is really unprecedented, and it is the light at the end of the tunnel for this outbreak, because we will be able to crush this outbreak ultimately with a highly efficacious and safe vaccine, and we have more than one of them. But directly to your question, that in fact it's fortuitous that you asked me. Literally 10 minutes ago, I was on a phone call with the vice president and all of the governors of all the states, talking about just the question you asked about getting the material to the local places. So Operation Warp Speed is an endeavor, and the part of it that is the transportation of the candidate vaccines is under the auspices of a general in the Army who has great experience in logistics and transportation of material. That can be done, and that will be done. Once it gets to the local place, the town, the city, the state, the local health authorities will be responsible for the equitable distribution of the amount of vaccine that was allocated to the state based upon the prorated population of that state.
And so when we talk about the efficacy and the distribution, what assurances are in place with regard to the safety of the vaccine development, considering the process acceleration this time around?
Well, I think that's a great question. I'm glad you gave me the opportunity to answer, because the public needs to know that the speed of it was based purely on phenomenal scientific advances that we didn't have 5-10 years ago, as well as an enormous investment in resources to make things happen in weeks to months that would have taken months to years. So that was not compromising safety, nor compromising scientific integrity. Second, the process of proving that a vaccine is safe and effective in the clinical trial, that is determined by independent bodies called data and safety monitoring boards that are not beholden to the administration. They're not beholden to the company. They're an independent group of scientists, vaccinologists, clinicians, ethicists, statisticians, who are put together to examine the data. And when they determine it's safe and effective, then they allow the company to see the data. The company then applies to the FDA for either an emergency use authorization or a full licensure. The career professionals, the people who do this every day at the FDA, then examine the data and determine, in association with their advisory committee, which is the Vaccines and Related Products Advisory Committee, those groups, the VRBPAC group, make the determination whether or not it should be given an EUA or an emergency use authorization. So the process is independent and transparent. And I don't think that the general public fully appreciates all of the independent steps that one goes through before a vaccine is made available for the general public.
Thank you for making that distinction. Finally, Dr. Fauci, we know Dr. Slaoui, the head of Operation Warp Speed, said we could achieve herd immunity through vaccination by May. You have previously agreed that this timeline, optimistically, is possible. Are you still optimistic about that timeline? And what are the biggest barriers to getting to that point by May?
That's a great question. The biggest barrier is if people are reluctant to get vaccinated. So what Dr. Salawi was saying, that if we had a very robust and enthusiastic uptake of the vaccines that will become available for the general public probably in April. I think the high priority people will be getting it December, January, February, March. As we get into April and through May, it will be available for the general public. If only 50% of the population decides they want to get vaccinated, we're not going to have herd immunity in May. If the overwhelming majority of the population get vaccinated, we could achieve herd immunity. I would think from a practical standpoint, that likely will not occur until we get well into the second quarter, June, July, and August. But it conceivably could occur by May if everyone decides they want to get vaccinated.
Dr. Fauci, thank you so much for joining us here on Cheddar today. Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases, joining us here on Cheddar.